steps for medication administration. One of the most important tasks of AMAP staff is safe medication administration. Medication given incorrectly or given to the wrong person can cause serious injury and possibly death. Therefore, OPWDD and this agency have agreed on certain steps you must follow to ensure that you administer medication safely. This video also incorporates some techniques that most nurses use to ensure accuracy. These techniques will be labeled optional, however they are taught in this course as best practice. In order to maintain stable levels of medications in the bloodstream, medications are to be given at the same time every day. We allow an hour period from the assigned time. The hour period or window is a half an hour prior to the assigned time until a half an hour after the assigned time. For example, a medication assigned a time of 8 a.m. can be given during the hour period of 7:30 a.m. until 8:30 a.m. To help the medication pass go smoothly and to be accomplished within the hour window, there are certain tasks to be done shortly before the hour window begins. We will call these tasks the do-befores, meaning do them before you begin the medication pass. The do-befores include 1. Check the doctor's order against the MAR and make sure they match. Also look at the medication information sheet to know what condition this medication is being used to treat and any special instructions how to give the medication. 2. Gather all equipment needed. 3. Take and record any vital signs needed. 4. Wash your hands. Please observe carefully as the AMAP completes the do-befores for an 8 a.m. medication pass to 2 individuals. AMAP checks prescriptions against the MAR. Note that the binder can be opened and the MAR removed if desired to make checking easier. AMAP flips sheet over and reads why the medication is being given and special instructions.
Katy Perry, Prilosec 20 milligram tablets, 1 tablet by mouth daily, 1 tablet by mouth daily. To treat acid reflux, do not crush, break, or chew this medication. Swallow the capsules whole. Take this medication before a meal. Miranda Lambert, Valium 2 milligram tablets, 1 tablet by mouth daily, 1 tablet by mouth daily. Expected desired effect to help with anxiety. Special instructions: no alcohol. Zestril, Miranda Lambert, Zestril 10 milligram tablets, 1 tablet by mouth twice daily, 1 tablet by mouth twice a day. Hold for blood pressure less than 100/60, hold for blood pressure less than 100/60. Treatment of depression and special instructions: hold for blood pressure less than 100/60 and notify RN. Next med, Lexapro, Miranda Lambert, Lexapro 5 milligrams and 5 cc's oral solution. Lexapro 5 milligrams, 5 cc's oral solution. Give 5 cc's daily. Give 5 cc's daily. It's an antidepressant. Special instructions: administer with milk or food.
AMAP gathers the needed equipment. AMAP takes and records vital signs.
Hi Miranda, we're going to check your blood pressure.
AMAP washes hands. It is now 7:30 a.m. and the AMAP begins the medication pass. AMAP opens MAR to the first individual to receive medications. AMAP unlocks medication cabinet. Check number 1. The AMAP selects the correct medication and checks the medication label against the MAR entry. Check number 2. The AMAP checks the medication label against the MAR, line by line. AMAP checks the expiration date located on the reverse side of the blister packs. AMAP pops the correct number of tablets or capsules into the medication cup. AMAP dates, times, and initials the back of the blister pack. This is an optional safety technique. The AMAP places a dot in the box for the date and time the medication is to be given, checking that there are no initials in that box. This is an optional safety technique. Check number 3. The AMAP checks the medication label against the MAR, line by line, and then returns the medication to the cabinet. The AMAP repeats these steps for each medication needed. Tablets and capsules are placed in the same cup and dispensed individually or all at once, depending upon the desires of the individual who's receiving the medication. Chewable tablets should be placed in a separate cup from other tablets, and the individual should be given the instruction to chew it. Liquid medications are dispensed in a separate cup.
Katy Perry, Lasix 20 milligram tablets, 2 tablets by mouth, twice daily. Put it away. Next med, Prilosec. First check, Katy Perry Prilosec. Bring it down. Katy Perry. Prilosec 20 milligram tablets, 1 tablet by mouth daily. Expiration is good. Whoops. Initial date and time. That. During the final check, Katy Perry, Prilosec 20 milligram tablets, 1 tablet by mouth daily. Put it away. Close up my cabinet.
The individual to receive medications is called to the medication room. The AMAP identifies the individual and confirms the individual matches the photograph if unfamiliar with the individual. The AMAP briefly looks at the individual's exposed body parts to ensure all looks healthy. For example, no swelling, bleeding, redness. The AMAP hands the medication to the individual, providing any necessary assistance. The AMAP watches as the individual swallows the medication and provides water or the preferred liquid. The individual should be encouraged to help administer their medications to their level of ability as determined by their RN. For example, get their own cup of water or pop pills from the blister pack. The AMAP thanks the individual for their cooperation and asks about their day. We ask the individual a question and have them answer to be sure that they have swallowed the medication. The AMAP turns to the MAR and places their initials in the boxes for that date and time for all medications just administered. The AMAP checks to ensure that their initials and full signature appear on the MAR, either on the back or bottom, dependent upon the program. AMAP washes hands or uses hand sanitizer before preparing medications for the next individual. The AMAP repeats the steps outlined above to prepare the medications for any additional individuals who require medications at that time. If the AMAP is to administer a controlled substance, the controlled substance must be counted prior to dispensing the medication. If there is a difference between the number on the controlled substance count sheet and the amount on hand, the AMAP must notify the RN immediately before dispensing the medication.
Check my downs. Okay. pop in one. Randall Lambert, Valium 2 milligram tablets, 1 tablet by mouth daily. Next med is Zestral. Miranda Lambert Zestral, Miranda Lambert. Zestral 10 milligram tablets, 1 tablet by mouth, twice daily. Hold for blood pressure less than 100/60. Expiration is good. 1 pot. Dot. Third and final check, Miranda Lambert, Zestral 10 milligram tablets, 1 tablet by mouth, twice daily. Hold for blood pressure less than 100/60. Last med. Okay. Miranda Lambert, Lexapro. Miranda Lambert, Lexapro, 5 milligrams, 5 cc's oral solution. Give 5 cc's daily. Expiration, let's go. Okay. Miranda Lambert, Lexapro, 5 milligrams, 5 cc's oral solution. Give 5 cc's daily. Good morning, Miranda. How are you? Have your 8 AM meds? Have some water. This is your liquid med. I'll water wash that down. Okay, thanks. What are you doing today, Miranda?
I'm going to work today at program.
Awesome. Have a great day.
Thank you.
All right, Miranda.
Bye.
Bye.
Gloves are to be worn when applying topical medications. Change gloves when applying topical medications to different body parts. Remove contaminated gloves before replacing the cap on the medication tube or bottle. Wash hands after removing gloves and completing the medication pass for that individual.